Hello, I'm VJ Daniels, and I'm the Assistant Dean of Assessment for the MD program and an Associate Program Director of Assessment for the Core Internal Medicine Residency Program here at the University of Alberta. In this video, I want to explain standard setting, which is the way we set the pass mark for various activities such as written exams and OSCEs as two examples. So standard setting is a process used to create boundaries between categories such as pass or fail. Now, it can also be used to create boundaries for who's going to get an award, or a borderline group, or a group that requires a learning plan or remediation even if they have not failed. One of the key things about standard setting is it leads to the determination of a cut score. And that's the term we use in medical education as the score required to pass. Now, standards can be relative, norm-based, or absolute, criterion-based. Now, relative, an example would be, say you just decide at the bottom 2.5% or 5% or less than 2 standard deviations automatically failed, versus an absolute is a fixed number, such that if students are stronger one year, less fail, if students are weaker, more fail. And I think it's pretty obvious as soon as I say it that absolute standards are most appropriate when the focus is determining competence, which is most of what we do in medical education. Now, that said, an example where a relative standard could be used is if you really wanted to help as many students as possible, but you have a fixed amount of resources in terms of academic mentors or something like that, then you might reach out to the bottom, 4% because you just are able to accommodate that many people. And that would be okay. Because part of what it is the risks of being flagged are quite low in the sense that we're just offering extra help. So, one of the things to think about also, related to what I just said, is you set the cut score based on the consequences of failing. And this is one of the things I want to say is that standard setting is not completely precise down to, the 0.1%. Part of standard setting, in fact, the real crux behind standard setting is it's a judgment. You just have to have a defensibility to that judgment. So in my internal medicine residency program, where we have a lot of lower stakes assessments, like our OSCEs are more formative, I may set that cut score higher to catch more residents with whom I meet and coach because I ultimately want them to be good doctors and pass their certification exams. But of course, if you're running a high stakes assessment at the end of a program, and say, like a high stakes certification exam, where failing means losing a year of one's life, we have to be very careful and set that cut score so that we're a little bit more specific in terms of saying those who fail truly fail. So, one thing that you may have thought already watching this video is why not just a fixed number like 60%? Well, the benefits are it's familiar. Students coming through undergraduate degrees and through high school, this is what we've done. You need X number of percent to pass. And you can tell the students well before an exam if you know you need 60%, 65, 70%. However, there are drawbacks. And the first that's most important is there's no clear rationale for why 60% would equal competent. Right? You need to figure out a way to actually explain that. And the other thing is it does not take into account difficulty of items. So if you are kind of refreshing your bank every year and you add harder items one year, you should actually have a slightly lower cut score because your exam has become harder. Now, how not to use 60%? I just randomly picked it because I like the number. That's not defendable in any venue. Okay? However, there are still situations in how you can use a fixed number predetermined like 60%. One is you've been running the same block exam for several years and you have good historical data, sort of program-wide, that those who fail your exam are at risk of failing others without adequate intervention. So if you have historical data to support that your cut discriminates well, that's okay. The other thing is some testing bodies actually refine their items to target a specific cut, be it 60 or 70%. And so unlike what I've been talking about is refining the cut to target the items, you can do the opposite. refine the items to target the cut. So if you notice, I ran this exam, I wanted 60%, but honestly, looking at the items, it should be 55% this year. That's okay. But then you target those harder items to try and make them easier. Okay. And the key thing you can see here is we're talking about trying to figure out what just barely competent means. Now, when it comes to standard setting methods, there are test-based or examinee-based ones. Test-based standards have judges review test items and they estimate the level of performance of a just barely competent, or there's another term I'm going to use shortly. An example of this is the Angoff that I'm going to show next. Examinee-based standards judges categorize performance of individual candidates, and this works well in an OSCE because we have an examiner in the room watching. And then the scores in the different categories determine the cut score. Two examples of this that I'm going to go into in the OSCE part of this video are borderline group and borderline regression.